Hi, my name is Jessica, and this is my video reflection for this week on mental health and substance abuse. Before I start, I just want to say, I'm a nurse that works in the emergency room, and mental health and substance abuse is one of, or two of the biggest populations that we have coming in right now. And it's crazy to see how the substances affect the body and how once you're addicted, it's very difficult for these individuals to stop. Um, yeah, so let's go into the project. So this is my video reflection and three things I learned about mental health disorders. So these were all taken from the book, which I they're very interesting to me. Specifically, the first one deals with schizophrenic patients. So, some common changes occur in the brains of schizophrenic patients, including reduced gray matter in the temporal lobes, enlarged third and lateral ventricles, abnormal cells in the hippocampus, excessive dopamine secretion, and decreased blood flow to the frontal lobes. This is interesting to me because as I see these schizophrenic patients coming into the emergency room, I don't necessarily see the changes in their brain necessarily, and I wouldn't have known that these behaviors that the schizophrenic patients are exhibiting would necessarily cause a change and reaction in the brain. It's very interesting to know. And then the next one is that depression results from decreased activity by the excitatory neurotransmitters, norepinephrine and serotonin. This specific one, so I did know about the decreased activity of the serotonin, specifically because we give SSRIs to patients who are depressed. But it's still interesting to know that norepinephrine is involved as well. And then the last thing that I learned about mental health disorders are that panic disorders have a genetic factor. This is interesting to me because there are a lot of people that have um, panic disorders, anxiety interrelated with the panic. And I wouldn't have kind of correlated them to that genetic factor where it could be inherited from a parent or a sibling. Just very interesting. The next thing, so three things I learned about substance abuse disorders. Again, these are taken from the book. Alcohol is really a CNS depressant, although initially it appears to be a stimulant because it first depresses the higher brain centers used for judgment or the inhibitory neurons. So most of us drink alcohol, and I don't think we realize what alcohol does to our bodies. Um, Alcohol is one of the biggest substances that I see people abuse. And again, as I'm in that emergency room, the people that are coming in with alcohol abuse, it ravages their body in ways that I would never imagine. The effects it has on the liver, the effects it has on the esophagus, the effects it has on the brain. It really tears people down. And I feel like that's very important for patients to know how it affects their body because some of these patients don't understand that the alcohol is actually what's causing their symptoms. Um, the next thing I thought was that I learned was that often a cycle develops in which a person takes a depressant to relax or sleep and then needs a stimulant to wake up. Um, it may be common knowledge, like you think about it, people wake up and go to sleep with no issues. Most people do. However, these patients that abuse substances, their bodies are kind of um, they're relying on those medications or drugs to kind of get them through each day. And it's important to know that these patients need these depressants to sleep or stimulants to wake up because otherwise their body either goes into withdrawal or they just can't function. The next thing that I learned was that ecstasy increases basal metabolism and body temperature and is associated with dehydration and electrolyte imbalances that can lead to cardiac arrest. I don't see patients coming in on ecstasy a lot. So this to me was kind of an important thing to know, because if a patient were to come in on ecstasy, I would be able to kind of relate what is discussed here to what the patient's exhibiting when they come in. And that it's important to note the electrolyte imbalances that they may have, we need to fix quickly so that we can kind of deter from that cardiac arrest. And the next page is, how would I implement in my future practice? So my specialty is adult geri acute care nurse practitioner. So with the acute care part, I think it's very important that mental health and substance abuse is, like I said, it's a big part of acute care. Knowing what those symptoms, what those people are exhibiting, and kind of correlating them to the substances that they're taking, it's very important as a nurse practitioner to be able to identify those and kind of treat them, each one differently. Specifically, as I wrote here, there are many people that come in with an overdose. And some of the patients, you know, we give Narcan and they wake up, and some of them aren't happy and they want to leave. Others, they don't respond to the Narcan the same way that others would. And sometimes this leads to needing a higher level of care, specifically because they're either intubated or they're needing assistance with breathing or maintaining their airway. So I think that that kind of correlates to my specialty as a acute care, critical care nurse practitioner. And then I also wrote here the ability to identify mental health disorders and side effects that are caused by antipsychotics and other mental health medications. So the mental health patients that come in, I know a lot of them struggle to maintain their compliance with their medication regimens. And that's a big factor as to why the patients come back to the ER. Antipsychotics and a lot of other mental health medications have heavy side effects. And for me to implement what I've learned here, is definitely what those side effects are. And, you know, there's new medications on the market that kind of help not decrease, but I mean, decrease a little bit and might help the patients be able to tolerate those side effects long term better, while also maintaining their compliance with their medication regimen. I really enjoyed this portion of the class because, again, I see a lot of mental health and substance abuse patients in my current area of work, and it's helpful to kind of correlate things that I'm learning to things that I actually see. So I just wanted to be able to share that, and I appreciate you listening, and I hope you have a great night. Thank you.